So in this video we're going to be doing some manual muscle testing for the rotator cuff muscles. So we're going to be doing supraspinatus, infraspinatus, subscapula, and teres minor. So Josh, today I'm going to be doing some muscle testing on you, on some of the muscles in your shoulder here. And what we're going to be doing is looking for any sort of symptom response, the stuff that you came in with, how well you can coordinate the activation of those muscles, just to see if anything's kind of moving a little wonky. And then just see how strong you are as well. So we're going to give you kind of a subjective reading here. So I'm going to place you in a few different positions, and then I'm going to add some resistance. But I want you to tell me if you feel any of those symptoms that you came with. How does that sound? Mm-hmm. Okay. So we're going to start with supraspinatus. So for that one, I'm going to have you bend your elbow up to 90 degrees. Oh, sorry. Go down. We're going to flex you up to 90 degrees, and then we're going to bend the elbow 20 to 30 degrees with the thumb pointing up, kind of like you're holding a champagne glass. And I'm going to have you just hold that there. Good. And then bring that arm back down to your side. And then I'm going to have you go up and hold that position again. Perfect. And then I'm going to stabilize and then just pull at the distal end of his wrist here. And I'm going to add some slowly increasing resistance. So when I say go, try to hold your arm here as best you can, okay? Okay. Ready? Relax. And then we're going to be doing infraspinatus. This one we're going to do 90 degrees of elbow flexion, and then we're going to bring the arm out about 30 degrees, and then we're going to rotate that arm in about 20 to 30 degrees, keeping that thumb in a neutral position. And then I'm going to stabilize at the elbow, and I'm going to push you into internal rotation, so I'm going to push on the outside of your wrist here. Same thing as the other one. I'm going to be increasing the resistance, but first I just want to have you hold this here first. Good, and then relax. And come back to that position. Good. So now I'm going to apply that resistance, stabilizing at the elbow. Ready, go. Good, you can relax. Next one we'll do is subscap. So it's a similar testing position, but we're going to be testing the opposite way. Going into 90 degrees, out about 45, and then I'm going to externally rotate you as well. So just hold that position there for me, just see if you can hold it against gravity, and you can relax. And I want you to reposition yourself into that position. Okay, we'll do a little bit more. Perfect. So I'm going to stabilize at the elbow again, try to pull him into external rotation, and then I want you to try to resist me, okay, Josh? Okay, ready? Go. Good, and you can relax. And our last one here is going to be teres minor. So for this one, I'm going to get behind you. I'm going to be positioning you up into 90 degrees of shoulder flexion, 90 degrees of elbow flexion, and then just want you to hold that there. Good, and then relax. And then I want to see if you can get back into that position. Perfect, so stabilizing at the elbow again. I'm going to apply some resistance into internal rotations. I'm going to push forward. I want you to try to resist me and hold your arm in this position, okay? Okay, ready? Go. Good, relax. You can relax. So with that testing, if there was any symptom response that he came in complaining of with any of the specific shoulder muscle testing, that would help guide me with any sort of special test I would want to do to further back up maybe a rotator cuff tear or tendinopathy. In this video, I'm going to be doing some musculotendinous pathology tests for the supra and infraspinatus and then the subscapularis. So Josh, with these tests that I'm about to do on you, I'm going to be looking at some of the muscles in your rotator cuff, so the ones that are inside your shoulder that help with some internal rotation, external rotation, and then also just stabilizing the shoulder joint. So what I'm going to do is placing you in a couple different positions, and then what you should expect is possibly some pain with some of these tests, and that pain might indicate either just a tendinopathy or a rotator cuff tear. But let me know if you do feel any sort of pain, and then we'll go from there. How does that sound? Good. Okay. So the first one we're going to do is going to be for your subscap. So these first two are going to be for that same muscle, and that one's responsible for internal rotation. So the first thing I'm going to have you do is place your hand on your belly with your affected side, and then really trying to bring that elbow in front of you. And then with that elbow up there, I'm going to be assessing for that. I want you to press into your belly with your hand, trying to keep that elbow there. Good, and then I'm going to slide my hand in here just to see how hard you're pressing. Good. Any pain with that? Okay. And then I'll have you flip around so the camera can see. So this one, making sure you're sitting up nice and tall. I'm going to have you bring the back of your hand to the lower part of your back and just place it there. Good. And then with this, I'm going to have you try to bring that hand away from your back with staying nice and tall and without trying to bring that shoulder forward, okay? Good. Any pain with that? No. Okay, good. And you can relax. So both of those testing that internal rotation. The next two, I'm going to actually have you stand up. This one's going to be testing a couple of other muscles, your infra and supraspinatus, which are going to be responsible for the opposite movement, that external rotation. So our first one here, we'll just say your right is your affected side. We're going to bring that elbow into 90 degrees of flexion, and then we're going to bring you out to about 30 degrees of scaption, and then bring you into that maximum external rotation. And then now that I have you here, I want you to try to hold this position after I let go. Ready? Good. And so, any pain here? Good. So if there was pain, or if you did follow that position, that would have indicated a tear or some other kind of pathology with those two muscles that I mentioned. And then our last one's going to be our drop arm test. So for this one, you're going to go out into that kind of 45-degree plane, just like I had you in that previous test, and you're going to bring your arm all the way up overhead, however quick you want, but on the way down, I really want you to go nice and slow, controlling that motion until you get back down to your side, okay? And going thumb up throughout, good, all the way up, and then nice and slow down. Good, any pain with that? Okay. And if you had fallen right around kind of that shoulder height level, and it would have given away, that would have indicated a tear pathology in those same sort of muscles. So if you had felt any pain or failed any of those tests, it would have indicated a possible tear or any other sort of tendinopathy or pathology in the rotator cuff muscles. So in this video, I'm going to be doing a scapulothoracic MWM. So what I'm going to have Josh do is just bring his arm up into flexion, and I'm going to assist the movement of his scapula. So Josh, in this technique that I'm going to be doing, the reason I'm doing it is because I saw some limitations when we were doing your active range of motion assessment, and then you also complained of some pain kind of near that end range. So what this is going to do, I'm going to help move your scapula kind of down out of the way, and that should open up some space at the top and allow your arm to get that extra range of motion without any of the pain or anything running into the structures that are a part of your shoulder joint. So you shouldn't feel any pain. If you do, let me know. But we're just going to start off with a couple reps here, like 3 or 5, and then I'll reassess, see how it went, and if it was successful, then we'll do it as a treatment option. How's that sound? Good. Cool. So I'll get behind here, just rest my hand on the shoulder here, right across the clavicle, just stabilizing, and then I'm going to get underneath the scapula, wrapping around the entire inferior portion of it, so like the medial border, inferior angle, and then around to the lateral border. So Josh, I'm going to have you do that motion to bring your hand up overhead, and then I'm just going to facilitate here. So do 5 reps, okay? How's that feel? Good. Good. So let's say that was successful. We'd go in, do like 6 to 10 reps of 3 to 5 more sets, and see how he feels after that, and maybe progress to some movements that he would do on his own without any of the assistance that I would be providing, to see if it stuck in his muscles and everything, we're able to follow that sort of guidance and everything. So for this very last video, we're going to be doing middle trap awareness testing and training. So Josh, what we're going to be doing here, we're going to be training your middle traps. It's the ones that are just in between your shoulder blades here, and they're responsible for retracting your shoulder blades back, so pinching them almost. And that helps with posture and just better alignment of your scapula and movement of your arms. So the first stage we're going to be doing here, I'm just going to have you have your, just like you have on your arms here, up at about 90 degrees of shoulder flexion, your elbows at 90 degrees of elbow flexion, and then just hands resting on the table. And then starting nice and relaxed, I'm just going to be tapping on the muscles I want you to activate, and without moving anything else, just try to activate these muscles and just pinching them together. So I'm happy to do that right now. Good, and then I just ask for any other sort of musculature to make sure it's just his middle traps, and then you can relax. So that'd be stage 1, and then we can progress that to having him pinch again, but with his thumbs pointing up, bringing just his wrists off the table, seeing if there's any other musculature that gets activated, or if it's just that, and that looks good. So you can relax. And I'm looking for either upper trap or lats or rhomboids or anything like that that might be activating. So that was 2. So on the third stage here, I'm going to have him do that same pinch in the back, getting that activation. And then with his thumbs pointing up, he's going to bring his elbows off the table now. Good. Upper traps are still relaxed. Lower fine. Lats seem to be fine. And you can relax, Josh. And then finally, with just using body weight, I'm going to have him go arms all the way up to the side like a T. And then I'm going to have him activate his middle traps again. So activate them, Josh. And then bring your arms up off the table. Good, just increasing that lever arm. And then I'd say this might be where he would fail a little bit, just because it looks he's getting a lot of like teres activation over here. Lats seem to be fine, upper traps seem to be fine. So I'd probably stick around this region, but if you want to progress this further, Josh, you can relax. You could do that arms out to the side and just adding weights or a resistance band that's anchored somewhere to the ground, or a therapist holding it, and then having him retract his shoulder blades. And that would be it for middle traps or awareness training. So starting with that tactile cue, and then progressing to increasing that lever arm. So we're going wrists, elbows, and then straight arms, and then hold on to weights.